anytime we've got an open wound, we want to heal that as fast as possible, especially with our pets. They're not the easiest things to doctor and keep bandaged. I don't know about you, but I'm always trying to take that thing off. So we want to help accelerate the healing process. And that's what the lights will do. They'll accelerate the healing and stimulate the cellular repair. So that will happen faster.
Welcome to the Pet Care Report podcast by Pet Summits. Here's your natural dog healthcare host, Alora McKinley.
G'day guys, thanks for listening in to another episode of the Pet Care Report. Now joining me today is Sharon Katzke, President and CEO of Phototonic Healing, LLC, creators of the R-Light and Vision Light. With over 20 years as a CEO of an engineering firm, Sharon combined her unique skills to develop the R-Light, which has become an industry leader. Since 2012, she has dedicated her efforts to advancing the R-Light and now focuses on offering training and certifications. Sharon has shared her innovations at pet expos and events across the US and Canada. Thank you so much for joining me today, Sharon.
Thank you. It's my pleasure to be here. I always love to be able to share information and talk to people. Anytime I get a chance to talk, I'm game for that.
Now, today you're going to be chatting to us a little bit about light therapy, which is something that I've used on my own dogs for multiple different things. But for our listeners that might not be familiar with light therapy, could you just give us a general introduction to what it is?
Sure. So light therapy has been around way back in the days of the Egyptians. They understood the value of light, and light is a nutrient, just like food and water is. So we have to have light in our life to survive. That's why people, when they get sad and they get that other issues going on when they don't get enough sun and enough light. So light is a basic nutrient that we need. Now, how do we get it? We are using lights. Traditionally, we used red. And then we started using infrared with red, and then we were adding the blue, and then we learned about green, and then we started adding all of those together, and now we combine even those colors to make what I call polychromatic light. Now, people have been calling polychromatic light the combination of red and infrared for a long time. To me, that's not really polychromatic light, because when you combine red with infrared, your brain still sees and processes red. But when I combine colors like a red and a green on a pad per se, and I'll show you real quick so you'll understand what I'm saying. So I'm going to put red and green on, and on this side, you can see that the red lights are on and the green lights are on. But when I put that up against my skin, what color does your brain see? Yellow. So now we process a third color. So we got yellow, we've got, my favorite, which is, whoopsie. Did I shut you off? I think I shut it off. There. When I put blue and green on together, look at that beautiful turquoise color. I mean, turquoise to me is very soothing, and each color has their own property, and we can talk about that for a little bit too. I get ahead of myself when I start talking about the turquoise, because that's something that people don't have available to them in other tools. One of the things that was real important to me when I developed these tools was the ability to do that and not be limited to a red pad or a blue pad, or, well, now some companies are coming out with green. But that's it. That's in their pad, a green. So now you got to buy another pad that's just green, and now you're back to carrying all these tools. Versus we put them all in one, and then we added the sound frequencies to that, and those combinations are incredible for healing.
Yep. And you mentioned that this has been something that's been used for a long, long time. Are there any scientific studies to back up the use of these lights?
Oh, there might be one or two out there if you really go and dig. No, I'm just kidding. There's like 10,000 of them, and then some. And every day, more and more come out, because the researchers are really starting to understand how powerful this is. And a lot of the studies are on red and infrared, but more are coming out with blue. We're hearing more studies about green. And we are pushing the envelope a little bit with some of our colors, but we go back to the 70s and we follow the ways of the training back then when the guy was using lenses over their eyes just to create color and what those different color properties are. So we base our colors on those.
In terms of our pets, what kind of things are these lights helping with?
So the biggest things that we work with our animals are pain-related issues and then wound healing. Okay, so anytime we've got an open wound, we want to heal that as fast as possible, especially with our pets. They're not the easiest things to doctor and keep bandaged. I don't know about you, but I'm always trying to take that thing off. So we want to help accelerate the healing process. And that's what the lights will do. They'll accelerate the healing and stimulate the cellular repair. So that will happen faster. And when we add the blue to that, now we have the antibacterial and antifungal properties of that. And so it's kind of like your antibiotic ointment that you would put on an open wound. So if you put red and blue on an open wound, you're going to have healing much better and all naturally, as opposed to doing it a traditional way where it could take 10 days before you need your stitches out and 6 weeks before your bone is not broken. We can speed all of that up. And then the other big issue that we work with is joint pain. We have animals, dogs, pets, you name it, from little tiny young ones to big old dogs, or even old little tiny dogs to big young dogs. They all have joint issues at some point. The bigger the dog, the more prone they are to getting those joint issues, early on in their life. And if you happen to be using your dog in a performance setting, say you're doing agility with them and they're doing a lot of that back and forth, they're going to develop joint problems. So you want to help them before, during, and after. We don't need them to wait until they've got a joint problem to support that. You want to avoid that. Our athletes don't wait till they get hurt to be, stretching and conditioning and doing everything that they need to do to perform the best. So we help with that. One of the things that I see that really troubles me a lot is people that play frisbee with their dog. And you see it a lot. And they don't think at all what that is doing to that dog to jump up, spiral in the air to grab that thing, come back down and land over and over again. Throw a ball, have them go fetch the ball. But the jumping up in the air to grab that frisbee is going to give you a problem sooner or later, guaranteed.
If a pet owner is going to use it in a preventative manner, how often will they be using the light?
So we say if you're going to do preventative, it depends on the schedule of what your activity is. So maybe you're doing weekend competitions, then you're going to want to do that a couple times going into the competition and then right as soon as you finish that competition, and then maybe give them that day off. There is not one way to do any of this, which is kind of a challenge to get everybody on board with using it. There isn't just, everybody wants A, B, C. And when you're working with energy and you're working with animals or people, or because this is good for people too. I mean, it's not just we put this on our animals, we absolutely put these on ourselves as well. And I completely lost my train of thought.
If we're using it with our animal for maybe like chronic pain, because I know it's very commonly used, and as you mentioned, maybe for arthritis, chronic issues, how long does it take to see an effect from using the light?
That's an excellent question. A lot of times it's instant. You can see the animal react instantly, whether they go lay down, whether they give us a big yawn or a stretch. A lot of times they'll just go to sleep. And if they're walking in a way that you can visibly see that they're struggling and you do light therapy on them, you will see them move differently. Now, is it permanent? No, it's temporary. And the more you do it, the less you have to do it because it didn't get there overnight. You have to unravel this onion one layer at a time.
Can you explain a little bit how the light works in helping the animal in that kind of situation?
So as the light travels through we place it directly on the skin. We use an LED. LEDs, the further away from the skin they are, the less intense they become. So we like to have no gap there, and we don't have clothes on. And it'll go through fur because hair is actually alive. It won't go through a dead, matted up chunk of hair, but it will go through the follicles. So we put this directly on the skin, and when we do that, the light travels through the dermis and it stimulates the mitochondria in the cell. Okay? That starts a chain reaction. It sends a signal up to the brain that says, increase my ATP production. That releases your endorphins and your serotonins and your anti-inflammatories. And it's sort of like telling the body, hey, you forgot about this. And we reckon it to putting jumper cables on a dead battery. It's like, come back and heal. You forgot about this. Because after you've had chronic pain for not very long, it's different for other people, and I've heard different things, but maybe between 2 weeks and 2 months, it becomes chronic. And your brain sort of shuts it off. It resides in the frontal lobe and says, that's what we're going to deal with for the rest of our life. And you compensate for it. And your body stops sending signals to heal. So we just kind of recharge that signal again.
There you go. And so different colors, you mentioned before, we were talking about the turquoise, the green. Can you explain what different colors may assist with?
So on our website, we've got a chart, and we just have it broke down very high level because there's so much that these lights can do. And there's a lot of overlap as well. Infrared is the light that's going to travel the furthest into your body. So we're going to use that when we want to maybe impact the organs, get into those joints, get past the dermis. And infrared also works with the water in our body. So since we're like 90% water, that has become very effective in transmitting the signal through. So the benefits of that color is that it's for acute and chronic pain management. It will relax muscles and it reduces inflammation of your bursa. Very high level, just the top 3 keys. And the ailments for this color, well, any alleviation of pain from injuries, arthritis, or sore muscles, and anything of bursitis symptoms. So any itises that we wind up having. Then red, which we've had forever, red was probably the first color that has been discovered that it has any kind of properties for the body, and that was done with NASA. They discovered that it has healing properties, and it was healing the astronauts' hands in space. And they're like, what are you doing that we're not doing? And like, I'm tending to the plants, and those plants are being grown under red light. So that's how that whole thing got started. So we call it the great energizer. Red is an exciting color. It stimulates everything. You see it, it's a big, bold color, right? So it energizes the organs and the senses. It increases your circulation and the blood flow, and it releases the stiffness and constriction. That's one that we can get something happening on the spot. So I do a lot of trade shows, and people come in and are like, you got to show them something that they're going to get a result for right then and there. What's stiff? What can't you move? Where's your range of motion? Well, I can only go this far with my head, but I can go this way. Okay, well, now we're going to put them, and next thing you know, they can go further, and they can see the difference right then and there. So we use it for healing of wounds, cuts, scars, and trigger points. Our acupoint therapy was all based on using red light and blue light, and we use it for acute and chronic pain management. So then the blue light came along, and we call that the great antiseptic. And because it has the antibacterial and antifungal properties, you remember they were using it for babies and jaundice years ago. That's when we first started learning about blue light. Well, it is great for soothing and cooling. I say it's ice in a light. So if you have something where you're like, oh, you smack your hand or you burn yourself and your thought is, I got to get some ice on that, grab the blue light. Blue is ice in a light, but a lot easier to carry with you in your purse than a pack of ice, right? So we talked about it also being antibacterial, antifungal, and it just reduces that acute inflammation. It will stop the process. So if you have a sprain and you get blue light on that right away, it'll skip that really nasty purple ugly stage and get into that yellow-green stage way faster. So we use blue to reduce inflammation and injuries, combat fever and infection, and acne scars. It's also great for our throat, any throat-related conditions, whether it's a sore throat or when you had laryngitis the other night where you lost your voice, blue light would be very effective for that. So those are those three. And then green light, green has come along and it's by far my favorite color. We're just really starting to use it for a lot of things. And at first, red is over here on the visible scale, blue is over here on the visible scale, and green is right in the middle. So we call it the great balancer. It also is the most predominant color we have in nature. And what do we do when we get, you got a beautiful green sweater on. I just love it. But we go sit under the tree, or we go for a walk, or we go to the park. We go somewhere and we don't realize what we're doing. We're surrounding ourselves with the green. It has now become one of the fastest areas of study, and they're finding that it releases so much more oxygen than the red does, that it's great for pain relief, migraines. For people that have migraines, green is the color to go to for that. It's a very relaxing way to come out of it. Sometimes we'll have an animal that shies away from red. It's too much for them. And animals can't lie. So listen to them. If they're saying it's too much, it's too much. Give them green. They come back and they're like, that's a different story. Like the green.
How long do you have to use the light for it to be effective?
Sometimes it's instant and sometimes it takes, longer time. We're dealing with energy, and there's so many variables that go into this. There's a variable on the condition. How long has the condition been there? There's a variable on the person. What's the health of this person? Two people come to you and they both got in a car accident 6 years ago. One of them is a smoker and 300 pounds overweight, and one of them's a runner. Which one do you think is going to respond better to the light therapy? So it always goes back to it depends. And I know it's so frustrating when people are like, well, it depends, but it does. And then today what I want and tomorrow what I want might be different depending on how I slept last night, depending on what kind of phone calls I've had to deal with this morning, what my stress level happens to be. So we start the pads with a 20-minute session on certain body parts, and we say, let that go. Let that be for a bit. Let that soak in. Your body needs time to absorb it. And we like to go low and slow. So I kind of describe it as growing your garden and watering it. Would you water your garden with a fire hose, or would you water it with a drip line?
It's a good analogy. I like that.
That's the way we deliver the light. People don't think about it. They think more is better, bigger is best, blah, blah, blah. That's how our mindset is. But when we're talking about energy, low and slow, trickle is really what you want.
And now when I have used light therapy in the past for my dogs, I always go to see a professional that does it all for me. But it seems like your products can also be used by pet parents. Would that be correct?
Absolutely. These are intended to be done at home. The pads are completely cordless and flexible, so they can wrap around a body part, or we've got ones that fit dogs, from itty bitty tiny dogs to great big huge dogs that are the size of a mini horse, because I have mini horses and I wanted something that would fit them. So we have the different pad sizes, and then we've got, different lengths as well. Some that can go over your face, some that can go down your spine, behind your leg when we do lymphatic release, that fits in our pockets. So there's a lot of different ways to use the light. And the only time they don't work is when they're sitting over there on the shelf and you aren't using them. So you want them in your head.
Yeah. Are they quite simple for pet owners to use?
They're very simple. You can literally take this, turn it on, pick a color, and push the power to make it go. It can be as simple as that, or it can be as involved as, how do those Nogier frequencies work? I want to use one of those, and I want to combine my color blue and red together because I want to work with magenta, and I understand that, and I'm ready to take that to the next level. So these pads are intended to be used at the very basic level to the very highest level that you want to learn.
You mentioned sound a bit before. Can you expand a little bit on that?
So sound with our frequencies is our Nogier frequencies. Okay, so we combine those. You can either pick the Nogier frequencies, which is the 7 Nogier frequencies that are our cellular resonance. When we were born, our bodies resonate at the perfect harmony, supposedly. Okay. But as we grow, we knock them out of that. And by applying the light back to those frequencies, it allows those cells to go back into resonance. And the best example of that is there's a couple YouTube videos that have the metronomes where, the musical click, click thing, and they'll have 5 of them, and they'll start them, and they'll all be randomly going. And in about 30 seconds, they'll all have picked up and picking up, and they're going in sequence. And it's pretty neat. But that's what's happening with our body and our cells when we apply the right cellular frequency to it. So that's how we use the sound frequencies with them and you can either use it in our pre-programmed patterns. So we've gone through and we've picked the frequencies that are most commonly used for pain or anxiety or a nerve issue or and you can skip learning about those. Or you can take it to that final level and learn about what those individual frequencies are about. But you can be successful without that as well. So they are intended to be used for everybody.
Amazing. Such an exciting area of study. It seems like they're just finding different ways that these lights can be used for different issues that not only we face, but our dogs, which is really, really exciting.
Exactly. And it's not just a physical thing. We have emotional releases. We have mental struggles that the lights can help with. People with depression, with anxiety. Anxiety is a big one. Depression is a big one. They're finding huge research is getting behind Alzheimer's and Parkinson's and all kind of brain injuries, traumatic brain injuries. I say they are finally the research and the industry is like really opening up to this. Our biggest battle forever has been the pharmaceutical industry. They don't really want all of our information to be in everybody's hands. So sometimes we have that challenge to get over.
It's amazing. Now, if our listeners were going to take one thing away from this episode, what do you think that should be?
Oh, I took the time to think about that. And it said, my number one tip is not to wait. Do not wait until you have an issue to start the therapy. You can prevent a lot of later in life age-related conditions by doing preventative therapy before there are any problems or any signals to you that is a problem. Just health. We take our vitamins every day or supplements or whatever, and we do that to prevent things from happening, right? Like I said earlier, the only reason this therapy will not work is if the tool is not being used because it's sitting on the counter or in the drawer or who knows where you left it last. Sometimes the people are like, I don't remember where I left that, It's like, well, that's not good. You need to know it needs to be with you, and that's the only reason. So it needs to be in your hands and easily accessible at all times. And that is my number one takeaway from this. Use it. Just use it.
Great message. Thank you so much for joining us on the podcast today, Sharon, and teaching us a little bit about light therapy. Now, for our listeners that may want to find out more, maybe about your tools, where can they find some information?
So we've got, of course, our YouTube channel, which is Visumlight, VISUMLIGHT. Search for that. And we've got our Facebook page, and we've got our website, visumlight.com. And we're on LinkedIn, and we're on Instagram, and we're actually even on TikTok. So if you look for us, you'll find us.
Beautiful. I'll put some links down in the show notes so our listeners just can find you with the click of a button. Thank you so much. It was really lovely to have you on the episode today.
I appreciate it. Thanks so much.
That's okay. And for our listeners, don't forget to subscribe, leave a review, maybe ask a question. That helps us reach more pet parents with this episode. And I'll see you again next time for another episode.